Health Watch, we're trying to raise more awareness of pneumonia, a lung infection that not only makes it hard to breathe, but sends more than 150,000 adults to the hospital every year. And there's a number of different ways you can get pneumonia, but maybe the most common is from pneumococcal disease. One of those people who knows that firsthand how serious it can get is Karyne Jones. She's the CEO of the National Caucus and Center on Black Aging. Karyne, good morning. Thank you for joining us up here in Hartford. How are you?
Thank you, and I'm feeling great now.
That is really what is important. But how bad was your experience with pneumonia, Karyne?
It was very bad, and I'm a relatively healthy person. I got an extremely bad cough. I couldn't work. I couldn't eat. I couldn't drink. I really just I've never felt like that, never been that sick before in my life. And when I was diagnosed with pneumonia, the second that, I was able to come out of it because I was healthy. But I think about those people who have health conditions, chronic diseases, and 1 out of 20 people who get pneumococcal pass away. So that's why I'm working very hard in my organization with other aging and patient advocates to get the word out that the age for getting the vaccine for pneumococcal is now 50 and older, and we just want to encourage many people to get it because I don't ever want them to end up like me.
Yeah, absolutely. And you pretty much hit the nail right on the head. Do you know where are sort of pneumococcal vaccine levels now? How high do we need to get them? Because unfortunately, seem like we're in an environment these days where people are more and more distrustful of vaccines, even though they're clearly shown to work.
I know. And if everybody just thinks about where we were almost 5 years ago when we didn't have a vaccine for COVID, and we were hearing every day the thousands and thousands of people were dying. And once we got the vaccine, we saw those rates change. Well, the same thing could happen if we get the pneumococcal vaccine, in that you won't have 1 in 20 people dying of this disease, but you can protect yourself. So, and unfortunately, again, the vaccination rates are lower in Black and Hispanic and Asian communities. And so we certainly are trying to get the awareness out and understanding of why it's important to get this additional vaccine to protect themselves, especially during this respiratory season.
Yeah, and I'm glad you even mentioned COVID, Karyne, because a lot of the people who died from COVID-19, one of the contributing factors was pneumonia. Granted, it wasn't from pneumococcal disease, but like we said, there's a lot of different ways people can get pneumonia. All right, can you tell us, while you're here, what's some of the other work you do there with the National Caucus and Center on Black Aging?
Well, we're based in Washington, D.C., but we are a national organization. We, of course, promote health and wellness for our minority communities. We do training and employment and help older adults find jobs so that they can keep them out of poverty. And we, of course, own, manage, and help develop affordable senior housing around the country. So we're very involved in helping low-income older adults in making sure that they can age in dignity.
Okay, that is wonderful work that you're doing. Just back to your case, I'm just curious, how long did it take you to get over the pneumonia and to feel like you were back to 100%?
Almost 3 months.
Wow.
I didn't work. I wasn't able to go into the office for about a month, and I was just so weak and still suffering from such fatigue as a result of it. And the cough stayed with me about 2 months. So I would say after 3 months, I finally started getting back to myself where I could exercise and feel normal again. So it is impactful. And again, I'm healthy. I was healthy. So I think about people who have other diseases, and it could be much more fatal for them.
Another question, just in the short time we have. Sometimes pneumonia can come on very, very quickly. How quickly did it come on in your case, and what were just those initial symptoms?
The initial symptoms, I felt like hell. And I started coughing, and I couldn't stop that coughing, and it became very irritated, and I felt like my chest was about to explode. When I finally got to the hospital, that's when they were able to diagnose it and give me some treatments. But I think about people who maybe don't have access to health care and may wait and think that they can just do some at-home remedies, and it may be too late by the time they get to the hospital to care for them. So that's why if you're protected with the vaccine, your chances of survival of this are much greater.
Absolutely, right. If you get the protection before that disease ever sets in, you don't have as much to worry about for sure. Karyne, thank you so much for taking the time to join us just to get that word out. Hopefully we've made a lot of difference with people.
Thank you so much for having me.